Welcome everyone to one in a series of webinars from the BC Support Unit. My name is Pat Atherton. I work at the BC Support Unit. Our series of webinars is recorded and made available on our website at www.bcsupportunit.ca, and we encourage you to go there and review the recordings, and feel free to share the links with your colleagues. I'm pleased to welcome today N2's Erin Cherban, also from CHÉOS, as well as other places, and Don Richards, who are going to present on the network of network member benefits for your edification today. I'm going to be muting all participants in this call, and I will be asking at the end of today's presentation that if you have questions, to use the chat function in WebEx. You'll see in the top right-hand area of your screen a little box that looks like a thought bubble or dialogue balloon from the old comic book days with the word chat under it. If you pop that open, you'll be able to chat with our presenters or with me as your host, and I'll make sure that your question gets shared with the presenters at the end of their presentation so that we can have a dialogue at that time. So with that, I'm just going to mute everybody so that we're not having any interruptions. And with that, Erin, I guess we're ready for you to get going.
Okay, perfect. Thanks very much, Pat. And thanks for joining the webinar today, everyone, and for those people that will join later. As Pat said, my name is Erin Cherban. I wear multiple hats like almost everybody in research, but one of the roles I'm going to be talking about today is the Network of Networks. I'm on the Board of Directors, and I'm the Secretary to the Board of Directors. And I'm going to be presenting the first half of the webinar, and then Dr. Don Richards, who is our Business Development Specialist, will be presenting the second half of the webinar. And at that time, Don, if you want to say a few more words about yourself, I would say that's a great time to do that. But I just wanted to let you know, too, that Dawn is the Volunteer Vice President of the Canadian Arthritis Patient Alliance as well, as being the Business Development Specialist for N2, and she wears many more hats like the rest of us. So one of the things that has been wonderful about N2, and I'm going to give you a little bit more background about it, but the main reason it was really started was for, not advancing, to reduce administrative burden. I mean, as you know, everyone that works in research is overburdened with different requirements and too much paper. So we're certainly happy to help that within Canada. A little bit of information for you about why you're now members of N2 if you haven't been in the past. So the Academic Health Sciences Network has entered into an agreement with the Network of Networks, and this is all supported and managed by Clinical Trials BC. And this is really an effort to provide everybody that works in academic research in British Columbia the opportunity to have access to all the different resources that you're going to be hearing about today. And the slides, as Pat said, will be available, so if you have specific questions, there's the links for different people and the support units as well. And a little bit more information about the Academic Health Sciences Network organization, as it is fairly new, and I think a lot of people work within it but also have questions about it. So it really is here to connect and to connect us in BC to make sure that we can deliver high priority and high impact innovations for our health system. And it does integrate a number of existing and resources or existing organizations within the province and resources. So the BC Support Unit, as you probably all know, advances patient-oriented research and trials. And then Clinical Trials BC is really here to strengthen our capacity and competitiveness for attracting world-class clinical trials. And the activities of all these organizations are overseen by a single Academic Health Sciences Board of Directors. And now switching gears over to a little bit more about N2. So here's our objectives. What is N2 and what are our membership benefits? And just to give you a little bit of history, N2 really was a grassroots organization that started between Linda Bennett and Karen Arts, both in Toronto. And they got together, they both worked in research and have continued to work in research. And they sat there having coffee one day saying, why are we reinventing the wheel? Why is every network redoing the work that they need to do when we could work together? So they began to work together and thought of different training courses that could be commonly used across different networks. So the ideas were good clinical practice training, because there really wasn't a Canadian-specific good clinical practice training available. Standard operating procedures, many more tools and training, and Dawn will speak about those. There's been a lot created over the years. And also to create a real Canadian collaboration. So Karen and Linda searched for the other networks that were doing research, academic networks, and everybody met in Toronto in 2006. And I've been involved in N2 since that time, so I've got a really long history with the organization. I'm always happy to volunteer my time, and I've always been really grateful to my employers that they've been happy that I volunteer my time to do this. We held our first annual meeting in 2008. The annual meetings are always held in Toronto in February, or they have been for the last 11 years. And then when N2 was formed, they had to seek volunteers because there was no other way to start moving forward. And so the first group of volunteers formed to develop standard operating procedures for research. And the first set of standard operating procedures have been audited for compliance to Health Canada and FDA regulations. And this continues to this time. N2 was and has continued to be a grassroots success. We have created the online GCP certification program, and membership has grown rapidly. I think just to make it simple for people, they join N2 and they have a whole batch of resources that they can access. Finally, in 2015, after all these years of having volunteers, we had a few part-time project managers who worked on specific projects. But we hired Shelley King, who is our administrative support person, full-time, and it's been fantastic to have her on board. She's really the glue that keeps us all together. And then Dawn, who's going to be speaking later, is our business development specialist. And we also have a communications specialist named Barbara Medlin, because we had heard from our membership that one of the real weaknesses we had was proper communication with our members. And then, as you'll see in a little bit, there's all kinds of membership types that are now within N2. So it's not just academic networks, it's hospitals, universities, pharmaceutical companies, CROs, independent investigators as well. So here we are in 2018, and we have over 130 members. And we have various groups that we work with now, because we are now seen as a very large group to disseminate information across Canada to the clinical research community. So we are an advisory committee member of the Canadian Clinical Trials Coordinating Centre. We hold memorandums of understanding with Healthcare Can, the Canadian Association of Research Administrators, and the Office of Biobank Education and Research. And then we have our second strategic plan. When we got big enough, we thought it was time to have a strategic plan. So we're working on releasing our second strategic plan in February. And that will be available for all members to look at. Our mission and vision. Vision is Canada's Alliance for Excellence in Clinical Research. And our mission is to enable and enhance clinical research capability and capacity in Canada. And we have 3 strategic initiatives. Basically, we want to provide tools and programs to conduct high-quality research. We want to act as a national voice for advocating for clinical research in Canada. And we want to leverage the alliances that are already available in Canada and across the provinces. Here's just an organizational overview. So in the center, there's the board of directors, and as I said before, we're all volunteers on the board. And then around the board of directors are the different educational offerings that Dawn will be talking about in a few minutes. Here's a screenshot of our website, www.n2canada.ca. And member resources. I'm going to talk a little bit at the higher level of the member resources, and Dawn's going to dive right into the resources that are available for all the different organizations that they can use at their centers. So as we said, we wanted to act as a national voice for Canada, and we participated in the Clinical Trial Summit in 2011. And we're also affiliated with the Canadian Cancer Clinical Trials Network. We've been trying to offer more networking opportunities. So we did hold a regional meeting in BC in 2015. And we're always looking for people to join the committees. We're happy to take on volunteers in the different committees that you hear about. So as Dawn talks through the resources, and if there's something that really strikes a chord with you, please feel free to contact us to join a committee. And going back to talking as a national voice or representing the nation, I wanted to just make sure that everyone on the call knows about the Health Canada changes that are coming April 1st, 2018, where Health Canada is going to be adopting the addendum for the ICH guidelines. Health Canada, we have had a very close relationship with them over the years, and they came to us to get assistance with offering broader consultation for the guidance document that's been released. So you can click on the link and to access the guidance document, and consultation is open till April 15th, 2018, even though they're adopting the guidelines on April 1st, 2018. And I really do encourage you to have a look at this guidance document they've created. It's quite good. They really give you a lot of details about what the legal obligations are for different stakeholders within clinical trials and how they interpret the guidance document as well. So it's really a helpful document. If you do read it and you find something that you would like to comment on, there's a link there to our SurveyMonkey where we're collecting information to disseminate back to Health Canada after April 15th. So that's just an example of one of the ways we've been acting as a national voice. And how do you access the N2 resources that Dawn's going to be talking about in a few minutes? Well, each member institution has a primary contact with N2, and I'm going to show you the BC ones. The primary contact is really up to them to determine how they want to make the resources available within their institutions. So there's various ways that they've done this. Sometimes the primary contact I'm going to give you is the person that you contact, and in other cases they've assigned a resource administrator to be the contact within their institution. And each of the primary contacts will be able to tell you how to access the resources within your organization. So here's the primary contacts that are part of the membership that was purchased by the Academic Health Sciences Network, or Clinical Trials BC. And I've put their names up there. I'm not going to read them all out to you, but it'll give you, at least within your institution, the person to access. And you can see there's a large number. There's also independent investigators that are involved, up to 20 of them under this membership. So I think if you want to find out who the independent investigators are, the best bet is to contact Jean Smart or Deirdre Rogers directly. And then just as well, so you're aware of this, there are other contacts there are other N2 members in BC. And when the provincial membership came up, the decision was made not to support for-profit organizations and national networks. So for example, I'm listed there as one of the contact persons for the CIHR Canadian HIV Trials Network. I'm also affiliated with Providence Healthcare Research Institute, but our national network offers these same resources to our network members across Canada. So this is not a concentration, these memberships on BC alone, they're national networks. Okay, and now I'm going to hand it over to Dawn.
Thanks, Erin. I think, Erin, are you going to transfer? Okay, here we come. I'm now the presenter.
Remember to share your desktop.
Pat, yeah, I'm sorry, I apologize. I don't see easily where the desktop sharing. Here we go.
I need to click the quick start in the top corner. There you go. You got it.
Okay. And okay. So thanks, Erin. I'm going to walk you through the member resources now, and this will give you a deeper dive into what's available for you. I'm just going to try and move this down here too. So the member resources are developed by different committees within N2 that are primarily driven by volunteers. Some of them do have project managers that help out a little bit to make sure things get done. So the first set of resources I'll talk to you about are the SOPs. So membership in N2 provides you with a set of investigative site SOPs that have been accepted by Health Canada. They're applicable to all trial sites, community and academic. And we've got some listings here of the latest SOPs, so natural health products, medical devices, investigator-initiated research, equipment collaboration. Our latest version, version 7, was released last March and went effective mid-last May. We also do have biospecimen-related SOPs. Those have been developed at the Ontario Institute for Cancer Research, and we do also have REB SOPs that we've created in collaboration with CARIB. So again, these are resources that are available to members within N2. And a few slides ago, Erin had shown you the N2 website screenshot. And just so that you know, for members, there's a separate login, and through that login, you're able to access a number of the resources that I'll talk to you about here. Okay. In terms of the educational resources, this is actually one of our largest offerings that people take advantage of. And N2 has partnered with the city organization to provide high-quality web-based and, importantly, Canadian-specific education modules on a number of research topics. And I'll go through some of those in a bit. Some of you are probably familiar with these modules already. They have quizzes. They will generate completion certificates for successful learners. And there's also a tracking system for all learners. So, you know, I think to date, since N2 has been offering these particular courses, there's been approximately 40,000 completed modules. So I'll go through what is available with respect to those city modules. There's the ICH Guidance E6 on GCP. And this is composed of 13 modules that represent these standards as they relate to clinical trials of drugs, biologics, and devices. This is actually one of the most used resources at N2 itself, is the GCP training. And it does include regulations for Health Canada, Division 5, the Tri-Council Policy Statement, and the FDA. And we do update these from time to time. So in addition, there are other educational modules that also, you know, people within clinical trials and clinical research, as well as others, will require to take at institutions or different sites. So those include a number of different types of research ethics, as well as responsible conduct of research, transportation of dangerous goods. There's Part C, Division 5 of Food and Drug Regulations, Health Canada Division 5, and we have also developed privacy and security for personal health information within the Canadian research environment. And in 2018, we'll also be adding 2 new courses, and that is the Clinical Research Coordinator Training course, along with a Biosafety course. So like I said, these modules have been, these as well as the SOPs are some of the biggest resources that we find that our members use and are a real benefit of membership, especially from a cost perspective. Each of these modules themselves runs a few $100s if you were to take them separately. And here, just to show you what some of the usage numbers are, as I mentioned, the GCP tends to be the biggest one that people have used. You can see as of just over a year ago, there was over 20,000 people who had successfully completed the GCP course. And then we've got responsible conduct of research is up there, as well as Division 5 training. So you can also see approximately when we've launched these courses. And I think it's important for you to know that we've continued to add courses to the curriculum based on feedback from members. So, you know, members have told us that additional courses would be helpful and what those are. And as a result of that, we've worked on those and added those to the offering. Just briefly, you can see the total number of users within BC to date for the various courses under the different headings too. So within BC, there's been just over 4,000 total courses completed. This doesn't indicate how many people have registered and not completed, though that number tends to be fairly low. So just to give you a sense of what's being used within your province, within the City Canada courses that we offer. We also do have a Clinical Trials Education and Awareness Committee, and this committee really actually used to be called the Recruitment Committee, but we had a bit of a reassessment and decided that it's really not N2's business to be recruiting participants to trials, but it is N2's business to be able to help its members do their job to seek out participants for clinical research as well as clinical trials. So this committee has done a lot of work over the past, especially 2 to 3 years, in terms of developing bilingual resources, especially to help members increase conversations and awareness about the importance of participating in clinical research and clinical trials. And important for you to know as well that when this committee developed these resources, it did a lot of work with patients and caregivers as well as clinical research professionals. The first resource that, one of the first resources that this group created was called the It Starts With Me website. So it's www.itstartswithme.ca, and it also has a fully bilingual site as well. And this site was developed also with the help of a small CIHR SPORE collaboration grant that allowed N2 to work with patients and caregivers to develop it. It really kind of is like a clinical research, clinical trials 101. So it's got a lot of information for potential research participants. And actually, we worked with some individuals from the Patient Voices Network at the time from BC to develop this resource. And really, if you take a look at it, it's basically designed as a somewhat logical conversation with whoever is reading it. So based on kind of where your thoughts are, if you haven't started a trial, there's just some information about clinical trials. If you're deciding to join, there's different information provided to you. It also includes a glossary and includes a lot of frequently asked questions for participants and others. So this is kind of the foundation of the Clinical Trials Education and Awareness Committee's resources that have been built not only for N2 members, but it's a public site, so anyone can really use it. Probably the important thing is it's branded as being N2, so there's no one affiliation that's branded here, but rather a collection of trusted individuals and organizations that have contributed to this. And then specifically for members, we've developed a number of other resources that they can download from the member portion of the website, and they'll have the same look, feel, and messaging as the website itself. So one is kind of a Clinical Trials 101 set of slides, and we have worked with members to deliver those slides via webinars, and those webinars can be found on our YouTube site. If you visit the website, there's also a video embedded in it, which is kind of a basic overview of clinical trials, almost like a call to action to have a conversation about them. And again, the video is available for download by members, and we have had some members also add some of their own messaging. Vancouver Coastal Health is one of those organizations that has downloaded it and added a few screens to it. We've also developed postcards that basically have a bit of a blurb about it, starts with me, and encourage people to have a conversation. Those are also available in English and French. You can just download them and use them at your site. Or you may choose to co-brand them as well, because we certainly allow members to do that. And then we've also piggybacked on the Canadian Cancer Clinical Trials Network's so-called Ask Me campaign. So the Ask Me campaign is something that they developed where people at sites or institutions wear a badge that says Ask Me about research or Ask Me about clinical trials, and then they're provided with a whole kit of resources for when people do actually ask them about clinical research or clinical trials. So they've allowed us at N2 to develop, to take their Train the Trainer kit and to develop it for our members. And so again, this is another toolkit that N2 members can simply access, download. They can make it their own and co-brand it with N2, but really the whole point of these resources here under the Clinical Trials Education and Awareness theme are really to help people start talking about clinical research and clinical trials. And so as much as possible, we've built resources to easily enable our members to do so. This is just a screenshot of the website that I've been talking about, and the video that you see there is the video that's available for download by members. And you'll also note on the homepage of the website, we do have some quotes from people who have either participated in clinical trials or had family members participate in clinical trials. And then you can see across the top of the screen the different sub-pages that are part of the website. So why participate, how clinical research works, getting started, and the FAQ is also where the glossary is. So we've had lots of people link to this, link to the YouTube video, and obviously we encourage you all to do the same as well. We do have a quality committee at N2, and a lot of what the quality committee does is looking at ways to facilitate or collaborate on initiatives that promote excellence in clinical research. They also do importantly function as mentors to N2 members who are preparing for Health Canada inspections. So the committee is made up of individuals who have been in the clinical research world for a while, and they've undergone inspections themselves, and they can help mentor others in this space. And they also are available to answer any kind of questions by emails as well that people might have about their own quality initiatives at their sites or learning more from others or with respect to inspections as well. N2 also has a metrics committee, and the metrics committee has been piloting performance metrics and systems improvement measures that can be used by organizations that conduct clinical trials. They have partnered with an organization that's US-based called the Metrics Champions Consortium, and available for N2 members is a Metrics 101 course that's been taped. And the Metrics Champions Consortium has been around for a while and has done a lot of work with organizations that do clinical trials, specifically with respect to measuring certain things. So I know a lot of people in institutions have to be able to report on metrics, and so this is one way that you can access some expertise to be able to set up your own metrics and report on those as well. We do also, for members, have I guess kind of an arrangement with the Metrics Champions Consortium to access other of their courses and webinars at a discount for members. We do also have a communications committee. So as Erin indicated at the beginning of the webinar, we heard loud and clear from people that one thing that they'd really like from N2 is better communications, both amongst N2 members themselves, as well as sometimes helping at your own institution to make sure all the benefits and values of N2 are known. So our communications specialist is happy to help work with you at your own institution or site around how you can best engage your colleagues with respect to N2 and making sure that they know all of the things that exist or helping you put out communications, etc. And they recently completed our website design. They do a regular newsletter. We send out news flashes as well. We do have some members that are solely focused on pediatrics, and we do have a pediatric interest committee. They have pretty ad hoc group discussions, but there's a few just pediatrics members, so if that's your area of specialty, you can certainly chat with them through our membership too. And lastly, just the contacts for you at N2. You can see Erin's contact there. Karen Arts is our chair of the board. Erin also, like the other board members, puts in a fair amount of time to N2. There's myself. I do not only business development, but a lot of outreach with members. Over the past year, as Erin indicated, we've been working on updating our strategic plan. And in addition to doing a survey of members, I also did outreach to about half of the organizations as well, just to clarify what we heard in our survey and to make sure that we were understanding correctly what their needs are and what the gaps in our membership were. And then, as Erin mentioned, we also have Shelley, who works full-time for N2. So Shelley is instrumental in everything that N2 does, including as a liaison with membership, answering any questions, helping you find the right person to talk to, helping you find the right resources that you need. So all of us are very responsive, and we're always open to our members' ideas, and you'll see that our updated strategic plan is really a reflection of us listening and adapting to the needs of our members. That's what we're based on is our membership. So I think that's it for me, and I'll pass it back to Erin as well as open it up, I think, for questions.
Thanks very much, Dawn and Erin. Perhaps, this is Pat from the BC Support Unit. Perhaps I will ask if there are any questions from participants. If you have any questions, you're welcome to use the chat function located in the top right-hand area of your screen. It looks like a little dialogue balloon. If you could click that and pose your question, I'm happy to read that to the group, or you can pose it to everyone. Erin, any thoughts from you while we're waiting?
No, nothing extra. I mean, I know that this is being recorded, so people that are listening to the recording, if they have questions as well, I mean, there's so many different contact emails within the presentation that I would really encourage them to contact any of us at N2 with our email addresses, or anybody else at the Academic Health Sciences Network, and we're always happy to answer questions.
Thank you, Erin. Any questions from the group? Maybe I'll open up mics and see if, and I apologize in advance if there's a lot of noise in the background, but I'll open up the mics and see if there are any questions by voice. Any questions from the group by voice?
It's Terry Fleming here. I just have a quick question. Just wondering if the invitation for this webinar went out to the other partners that we'd identified, like our local community clinical trial sites that we've added?
It's Deirdre here from Clinical Trials BC and the support unit. This webinar was publicized through our newsletter, through the support unit and the AHSN. So other than some email reminders I sent out yesterday to the administrators and the regional centers, it didn't go specifically to any of the community investigators or others, but it was in our newsletter. So if they had signed up for that, they would have received it.
Okay. I think when the slides are available afterwards or the recording is available, I'm going to pass it on to the community members that I don't see on the call right now.
Yeah, that's a great idea, Terry. Thanks.
Okay, thanks.
Thanks, Terry. Any other thoughts or questions from participants?
It's Colleen from Interior Health. Just a question around some of the access to the city program. I know that there's recently been a few releases of some fantastic programs that are available in the U.S., and I know that they're not available in Canada. However, recognizing that a lot of us run clinical trials that involve American companies, just wondering if there was ever an opportunity to look at accessing some of those programs here in Canada for our sites. Or are we strictly staying with Canadian-only content?
Well, I know if you want to access some of the U.S. resources, if you're a SOCRA member, SOCRA enables access to some of the U.S.-based resources, but I honestly don't know what that is open to, but it would be worth having a look at. On the SOCRA website, which is www.socra.org, there's a link there to CITI.
Okay.
But I think that when we really started working with CITI as the U.S.-based platform, it was with the idea to create Canadian content because we didn't have anything available at the time.
Okay. Thank you.
Thanks for the question, Colleen. Any other questions from those tuning in? I'll ask again, any questions from anybody? Okay, well, hearing none then, Dawn and Erin, over to you for any last comments or thoughts.
Well, thanks very much for joining us today. And again, if you ever need any information about N2 or are lost and looking for help, please feel free to contact us. Last words from you?
Oh, I think just to reiterate what Erin said, you know, hopefully you're able to find the resources that we've talked about, but if you can't, let us know. And we're always happy to take feedback like we just heard about the last question too. And maybe there are potential ways that we can find access to other resources that members haven't had in the past. It's at least good for us to know about those sorts of needs, and then we can see what we can do about them. So I really appreciate your time, everyone. Thank you.
Thanks, Dawn, and thanks, Erin, very much for your time today in presenting this webinar through the BC Support Unit. For those who are participating in real time, just a reminder that this is being recorded and the recording will be available on our website very soon, and a notification about the recording will go out via our newsletter, will be up on our website, and will go out via social media. So stay tuned for the link to the recording through those channels. Thank you very much for your time today, and we appreciate you forwarding along the link to the webinar to any of your colleagues who might be interested in learning more about N2's member resources. So thanks very much, everyone, and enjoy the rest of your days.
Bye.
Bye now.
Thank you. Bye.